guys, welcome back. If you don't know me, I'm Anna, clinical psychology doctoral candidate. On this channel, we talk about real life applications to psychology. And today I'm answering some questions that you all have about therapy as a construct. And so I hope that this is interesting as more of a Q&A, but let's see what your spiciest questions are. Do you think that sometimes therapists actually cause you to stew over the same problems and get really stuck in it like an anxious wind tunnel versus setting it aside and moving on? I feel like I'm the only one who can change me. I don't feel like therapy always gives me all the best tools or insights to do that, but I find I have made more progress putting small habits into my life, such as walking daily, using that time to reflect, and journaling my ideas, trying to make sense of it all versus going to therapy. It's interesting to me that this is the top question on there. I have to be honest, it's not something that I've really ever considered. And I think that might speak to maybe the type of therapy that you're getting. Some types of therapy are less directive. So just talking about your feelings, talking about what's on your mind, releasing those emotions, being validated by your therapist. And other types of therapy include things like assignments to journal, behavioral activation, like getting up and going for walks. So I think in some types of therapy, some of the behavioral daily habits that you're talking about definitely play a role. They're actually part of the treatment. Some treatment models believe that all you need in order to heal emotionally is to talk about it, to gain insight, to be validated and heard by someone. That's fine, that works for some people. Personally, I don't find that it works fantastic for me. If there are some clients who prefer that, I like to cater to what is best for them. But usually I try to also have some concrete things in therapy as well. And another thing is that therapy is not like a magic wand that you're waving. So it's not going to really solve everything for you. It's therapy plus what you do outside of the therapy room, because therapy in most cases is just 1 hour a week. So you have a lot of hours where you have to actually apply what you learned in therapy to your actual life. And I think it sounds like maybe what's going on with your therapy is that your therapist is not quite encouraging you to do those things, but they might not know that you need that. So I would suggest talking to them and letting them know that this is something you find more effective for you, and maybe finding a therapist who's more directive and structured, such as a CBT, DBT therapist. If you're going to leave a therapist, not because you don't need therapy anymore, but because of a specific reason regarding them, do you feel or think that you should tell the therapist why in a kind and constructive way or not? I think this really depends on the situation. Like I've heard some horror stories, mostly on the internet, about like terrible, unethical behavior from therapists. And in that case, I think you have no obligation to give them an explanation, and definitely not to pay extra money by going to a session and explaining it to them that way. On the other hand, if you feel like you do have a positive, healthy relationship with this person, if they've helped you in some ways, they're just not a great fit for you, it could be helpful to be honest with them. It could be an example of healthy communication in the therapeutic relationship as well. It could also be something that helps them, if they are open to criticism, if they're open to constructive feedback, this is something that could help them with future clients to realize, oh, some clients don't like when I do this or don't find this helpful, and making adjustments that way. Because I'm still in training, every time I terminate with a client, I pretty much ask for feedback, like things they would have liked to do more or less of, any suggestions that they have for me. And I think some well-established therapists might not be as open to that, but that could be part of the problem if they're not. But I think it really depends, you don't owe it to them, but it could be a healthy relationship to do so. I want to know about outcomes for online versus in-person therapy. I would hate to force therapists to be in office while we all happily work from home, but I personally feel that online therapy has been much less effective. I don't quite know what the effectiveness is. If I were to venture a guess, I would say that it's kind of the same. It just depends on the person. Some people really prefer in-person, some people don't care as much, some people actually prefer remote. I think there are probably still a lot of therapists that do in person, and so if that's something that is really important to you, definitely seek those out. It's not like you're forcing them to come in person. A lot of therapists choose to still do in-person therapy. A lot of therapists prefer it, and so it's really just a personal choice. I don't think it's like a blanket statement that online therapy is not as helpful or not as effective for everyone. I think in terms of types of appointments, like doctor's appointments you can have, therapy is definitely one that can be done from home in a lot of cases. But there are some people for who that's not a great idea or just not a great option. Are there certain types of therapy you find more effective, CBT or DBT versus talk therapy? The theoretical orientation that I primarily use is CBT, and I draw a lot of DBT in that as well. If you're unfamiliar, DBT is a subtype of CBT, so that is part of the reason. It is all talk therapy, so it's all talk therapy. Every therapy you can think of is the mechanism of change is talking about it. Of course, with something like CBT or DBT, it is a little bit more teaching, a little bit more structure and behavioral as well, but it is ultimately talk therapy. And CBT, DBT have definitely been found to be effective, but they're not the only ones. Most therapies are effective. The most important thing in therapy is the relationship between therapist and client. If that is good, then chances are the outcome is going to be pretty positive as well. And there are a bunch of debates in the field about whether CBT is truly more evidence-based or whether it's just more easy to assess those outcome measurements, or whether it actually results in long-lasting change. That's really, I think, up to the individual. Like, what you prefer, what you find more helpful is probably what's going to be most effective for you. So if you prefer CBT, go for that. If you don't like CBT, do something else. How do you avoid being involuntarily hospitalized? Talking about NSSI and SI so you don't get fired from other jobs or go bankrupt because you felt like you were safe with sharing and now you have a hospital chasing you out of bills. This is really frustrating. I really empathize with you, and I'm gonna be honest, there is no perfect answer. There is no solution to this the way that our healthcare system is currently set up. It is really messed up that if you are honest about your thoughts and feelings, sometimes that can result in being involuntarily hospitalized, and then when you're out of there, you don't have as many options and you don't have the support that you need still. But in order to understand the solution, we really need to talk about different levels of care. So it's not just once a week therapy and inpatient hospitalization for a week. If at the end of that week you are still in crisis, you might be a better candidate for residential. And that is, of course, something that not everyone can afford to do, especially if you're holding a job and trying to stay afloat financially. But it's also a misconception that if you're honest about these types of thoughts, especially past thoughts, that you're going to immediately be hospitalized. That's not the case. You need to be in imminent risk right now. And so just opening up about having some thoughts with no plan or intent to act on them, that's not going to get you hospitalized. It might be an indication that you might need a higher level of care, such as more intensive outpatient therapy or a partial hospitalization program. So if you can work that around your schedule, a lot of them are after work hours, and I know not everyone can afford it, but I think it's more feasible of an option than being involuntarily hospitalized. If you have a higher level of risk within those settings, they're probably not as likely to involuntarily hospitalize you because they have more access to you, more support. They're able to be a little bit more confident that you're not going to act on those thoughts. I get that it's not fair. I personally believe that every individual has the right to their own personal agency, but at the same time, I know that there are also a lot of people who, after coming out of those periods of those types of dark thoughts, are very grateful that they didn't act upon them. And I think it's tempting when you're in the throes of it to think life will never be better. This is just going to be endless pain forever. And for some people, maybe that would be the case, but I think for a lot of people that wouldn't be the case. And that's why there are these legal and medical sanctions intended to keep you alive. I agree that it's not ideal, but I think it's ultimately with the purpose of if you were to change your mind later on, that you would have the option of living. Why do therapists avoid naming and explaining the symptoms their clients experience? Why aren't they transparent about diagnoses? I think a lot of therapists, myself included, don't place that much weight on diagnostic labels. It's really there for insurance and to guide treatment. It's not something that I'm ever thinking like, oh, this person has social anxiety, this person is schizoaffective disorder. Like, that's not at the forefront of our minds. It's not important. It's something that's kind of imposed on us for health insurance reasons. And so I think a lot of the time the reason we might not bring it up is because it's not important to us and we assume it's not important to the client. If it is something like really to help the client understand their diagnosis, like I do this a lot with OCD, for example, or people who are curious about ADHD, I think it is important to go through the criteria, explain what they do or do not meet the symptoms for, explain their diagnostic label, what I would personally clinically judge them as having or not having. But that's really only if it is something like a disorder that is important for them to understand in order to heal, or if they ask about it. So if that's something that you're curious about, go ahead and ask about it, and by all means, they should be transparent about it. How do you cope with what you hear sometimes? Do you compartmentalize? Do you ever feel the need to step back for a second and take a break from treating certain people? Are you thinking about the therapist in The Sopranos? Yeah, good reference. I don't know. I'm good at compartmentalizing. It's just kind of the way I am. I've spoken about it before. I feel like I have average levels of empathy, and so I'm good at tuning in when I need to use that to help the person and work-life balance. And once I leave the office, I put that behind me. I try to close the door. If I'm still thinking about it afterwards, it means that I'm doing something wrong in terms of self-care. Not that the person shared something too severe with me, but that I am not putting in the work to take care of myself. I'm sure there might be situations where people would feel the need to step back from treating certain types of people, like perhaps personality disorders or very severe psychosis or something of the sort. But a lot of people also go into those fields because they're interested in that particular presenting concern, and sometimes that is what energizes them. How to draw the line? A lot of times I feel therapy is chatting with a friend and not like an actual step to help myself. I don't want to waste money to hear simple advices I can get on YouTube. That's valid, and again, I think this is a reflection on the type of therapy that you're getting and not a representation of all therapy. Therapy should not really feel like just chatting with a friend. If that's the case, either the therapist is doing it wrong or you just don't have much to talk about and you're just making small talk. If you want advice, yeah, you're probably not going to get that in therapy. That's not the point. The point of therapy is to give you the tools to help yourself. But if you're asking for tools from your therapist and they're not giving them to you, then it's time to see a different type of therapist. Also, I just want to mention therapy, if done correctly, should never be like talking to a friend, especially because therapy is one directional. You are talking about your stuff, your experiences, your feelings. The therapist should not really be self-disclosing too much unless it's with the purpose of helping you. And so it shouldn't be like a bi-directional conversation. It should be them really focusing on you. And that is really the only place, the only type of relationship where you can truly just focus on yourself. In any other friendship, understandably, there's going to be more of a reciprocal nature. My biggest issue with therapy is that I feel like after 10 plus years, I know everything by now technically, and it's hard to find someone I feel like really challenges me. So it's hard to find a provider in my network who's challenging me, Yeah, I can see how after 10 years you would know a lot. Guessing you probably don't know everything that there is to learn, but I understand it's probably hard to find someone who has something new to teach you or new to help you understand. And if that's the case, try to branch out to new theoretical orientations that you haven't had treatment from. There are still treatments that I'm learning about after studying this for 8 years. I just learned about cognitive processing therapy. I want to look into internal family systems and schema therapy. These are things that even I, as a trained clinician, do not know everything about. So of course you as a client also have new things to learn. So just be very selective. Look for new buzzwords that you haven't heard. Look for new approaches to therapy that sound novel to you. Look for therapists who are highly trained and highly good at what they do, and hopefully you'll be able to find someone. What should you do if you feel like your therapist does not understand you? How do you approach that conversation? That sounds very vague to me, so I would try to be very specific, come up with some examples of when you felt unheard or misunderstood, and very concretely explain what they said to make you feel that way and what you would like for them to do differently. So less global, I just feel like you don't understand me, more specific, here when you did this or here when you said this, I felt this and that, and here's what I would like from you moving forward. Should the therapist or the client do most of the talking during a session? I think definitely the client, unless it's very psychoeducational based, very skills based. That would usually be a group setting though. In individual therapy, I think in most orientations, people would argue the client should do most of the talking. Are there certain people that in your opinion would be wasting their time with therapy? I think the only type of person that would be wasting their time with therapy is the type of person that doesn't want to be there and doesn't follow through with actually making use of therapy. Certainly there are people that don't want to be there that eventually start to make use of therapy, but it's really are you making the most of your time that I think if you're not, if you just have nothing to talk about, if you don't want to introspect, if you don't want to make any change, if you are very antagonistic towards your therapist, then yeah, it might be a bit of a waste of time. But those are the only types of people I think anyone else, any other type of presenting concern can benefit from therapy. Do therapists get attached to their clients? Yeah, absolutely. I find myself still wondering about some of my past clients. Like, I would love to know, but it's not ethical for me to do that. And of course, I have no means to actually find that out. But it's like with any relationship. Like, of course, you're gonna be more attached to some people rather than others. That's just human nature. It's just how human interaction works. So there are a lot more questions, but this video is getting kind of at the time range where I want it to be, so I'm just going to stop here. Maybe I'll get to the other questions in a later video, so let me know if that is something that you would want for me to do. I hope that this was helpful. Hope it cleared up some questions that you had. If you have more, put them down in the comments as well, and don't forget to hit like and subscribe, and I'll see you soon.